Hello everyone, my name is Sherfat Abdusalam. I'm here today to provide prenatal education for a healthy pregnancy. I have my school attire on, my badge is on, no nail polish, no jewelry. I've already verified my physician's order and I'm going to my patient's room by knocking, entering, providing privacy, and then I'm going to introduce myself to the patient. I'm also going to identify the patient with two identifiers. I'm going to explain the procedure to the patient, seek their consent, perform hand hygiene. My patient, Mrs. Smith, I'm here. The doctor just confirmed to me you're pregnant. Congratulations. I'm here to give you the basic education that you need for this pregnancy, and this education will be provided throughout the duration of the pregnancy. For the things I'll be discussing today will be your prenatal care. I'm going to talk about nutrition. I'm going to talk about exercises, your weight, common complications, and warning signs that you need to be wary of during this process. Do let me know if I'm too fast along the way because there's going to be a lot of information that will be shared. First thing I'm going to do, because this is your first visitation, we're going to be having series of visitation during this pregnancy. Between now and 28 weeks, we're going to be having this visitation every 4 weeks. This is because we're trying to track your pregnancy, we're trying to track everything, and also to catch in on any complications along the way, if any. Then between 28 weeks and 36 weeks, every 2 weeks we'll be having a visitation, and then after 36 weeks till the time you deliver, we're going to be seeing you once a week. What we'll be doing during your visits will be to check your weight. We're going to be checking your blood pressure. We're also going to be checking for your fetal growth by using the Doppler to listen to the baby's heartbeat. We want to make sure we're tracking the growth, and we want to see if there's any possible complications along the way that we can catch in on. The other things, there will be a number of tests that will be carried out during the visit. We're going to do some lab work. We're going to be checking for hepatitis B. We're going to check your HIV status, check for syphilis. We're also going to check if you're immune to rubella. We're also going to check for your blood type, Rh factor. We're going to do some urine tests to check for possible infections and also to check for glucose in your body or any protein in your blood, sorry. And then where in some cases your doctor might ask for us to do some genetic screening. This is to check if there are any abnormal chromosomal abnormalities, just to check for that. This is going to happen actually during the first trimester. That is per provider's order. At 18 to 22 weeks, we're going to do an anatomy scan on you. This one, we're trying to check the organs to see the growth, to make sure the baby is growing well. We're also going to do some other glucose screening just to make sure you're not going through some gestational diabetes and some anemia. We're going to do some blood work. At 35 to 37 weeks, we're going to perform the group B streptococcus test, the GBS test, and then that time too we're going to do vaginal and rectal swab. We want to see if antibiotics will be needed during labor, and to make sure whatever it is will keep your newborn safe and also you very safe. Going further, I'm going to talk about your nutrition. Now that you're eating for two, it's very essential that you maintain a healthy diet. You must make sure your food contains fruit, vegetables, whole grain, lean protein, and even low-fat dairy. Proteins are essential for fetal growth, so it's very important that you eat chicken, you eat fish that are lower in mercury. You also want to make sure you eat egg, beans, and nuts. Non-pasteurized milk is ideal at this point, so make sure cheese, your yogurt, your milk, they are high in calcium because these ones will help with the baby's bone and the teeth development. You also want to make sure you do lean red meat because they are low, they are very high in iron. They are iron fortified. Spinach, beans, and even fortified cereal, they're going to help you with iron in your body, and it's going to help with transporting oxygen throughout the blood. You also want to make sure you take some daily prenatal vitamins. The doctor is going to order some for you because this one contains folic acid, and folic acid helps prevent neural tubal defect. Normal folic acid that you need to consume daily is about a minimum of 600 microgram per day. So this is going to be essential in that prenatal vitamin. Also, you want to make sure your calcium is right, the vitamin D is right, because they also play a crucial role. Also, for your nutrition, I will suggest that you make sure you stay well hydrated. You're taking a lot of fluid, a lot of water. This is a must for you at this time because the water will help facilitate the flow of blood. It's also going to help with your amniotic fluid and also your overall health. The third thing I want to discuss is the exercises that are allowed. For this period, it's ideal for you to do at least 150 minutes of exercise weekly, which when you break it down, that's like 30 minutes a day for 5 days. If you're able to do that, it's going to help reduce your stress level. It's going to help with your body. It's going to help also in distributing the weight that is ideal for you at this point in time. Exercises like walking, swimming, you can do prenatal yoga, you can do stationary cycling. These ones will help with blood circulation. Like I mentioned, it's going to help with your stress level and it's going to help distribute your weight. You want to make sure you avoid contact sports like skiing, horse riding, scuba diving. Even lying down for too long, you want to make sure you avoid things like that because you don't want to have other complications happen during this pregnancy. Should you experience any sudden chest pain, irregular breathing, discomfort, pain in your abdomen, please discontinue that exercise. If it doesn't stop, call your physician immediately. For your weight gain during the pregnancy, it's going to be based on whatever BMI you have at the moment. For instance, if you're underweight with a BMI of 18.5, we'll expect that you gain about 20 to 40 pounds during this pregnancy. If you have a normal BMI of 18.5 to 24.9, we're going to make sure you still get some weight gain of 25 to 35 pounds. If you're overweight, which is having about 25 to 29.9, 29.9 BMI, you're still expected to gain 15 to 25 pounds during this period. If you're obese, which is above 30, we still expect you to have an ideal weight gain of 11 to 20 pounds. So be very mindful of weight gains because the weight now is for two. So we want to make sure the embryo has the necessary nutrient, necessary nourishment. We want to reduce risk of hypertension to you. We want to reduce complications that will arise from gestational diabetes and delivery problem. That's why we want to make sure you have the ideal weight during this period. The other thing I'm going to discuss are common complaints that you're going to see. I'm going to talk about 3 of them. One is nausea and vomiting, which we call the morning sickness. Though normal, we don't also want it to be extended for too long because for every time you vomit, you're losing fluid, and for every time you're losing fluid, you're putting yourself and your baby at risk. So make sure for that you have dry crackers before bed. Make sure you drink enough fluid between meals. You want to make sure that you eat in small portion, and you also want to make sure to avoid greasy food along the line. The other complications that might happen is more like complaints that might happen is heartburn. This one too, make sure food in moderation, small portion, fluid intake. Make sure no spicy food. Sit upright after eating so you don't experience acid reflux. Excuse me. And then avoid meals that are greasy or spicy. Thirdly, I'm going to talk about constipation. For constipation, you want to include fiber in your diet. You want to make sure you have fruit, vegetables. You want to make sure you have whole grains, and then drink water and also do some regular walking, especially after eating. Lastly, I'm going to talk about warning sign. The first one is bleeding. If you have some bleeding from your vagina, just make sure you call your physician immediately. This can be a sign of miscarriage. It could also be a sign of placenta complications or even preterm labor. You want to make sure you call your physician immediately. The other warning sign is when you experience sudden swelling of your face, you have the sudden vision change, you have swelling of your face or your arm. Make sure you contact your physician, because this can be a sign of preeclampsia, which is hypertension in pregnancy, and it's very, very dangerous. So make sure, please, when you experience that, you call your physician. Lastly, if there is a lack of fetal movement, that could mean your baby is in distress. You want to make sure you escalate that by calling your physician immediately or taking yourself to emergency room, because it could be that your baby is having some distress, and we want to make sure we treat that immediately. Remember, if you have other vaginal issues like breathing, you're having unnecessary pain in your abdomen that is not stopping, you want to make sure you contact your physician or go to the hospital immediately. And if you feel there is an infection that you're feeling, sudden infection arising, make sure you come to the hospital so we have a check. So I want to summarize all I've discussed. I've talked about your prenatal care. I've talked to you about your nutrition. I've talked to you about the exercises allowed during your pregnancy. I've also explained the ideal weight that you need to get, and then common complaints that you're going to see during this pregnancy. Excuse me. And then all the warning signs that you need to know. I know it's a lot to take, but do you have any questions for me? Our patient said she doesn't have any questions for me. At this point, I've finished my education. I'm going to make sure the patient is comfortable, leave the room, provide privacy, perform hand hygiene, and I'll document the education provided. Thank you.